My name is Csomor Daniel. I'm specialized in anesthesia and intensive care unit. So my focus is the intensive care medicine. I'm working in a general hospital in Wiener Neustadt, and the second focus and also something which I love is the pre-hospital emergency medicine.
And what motivated you to be part of this program today?
To share expertise. To share expertise is really nice, not only to students, which we sometimes teach, not only to young colleagues, but there are colleagues of us coming to Wien and Wiener Neustadt who are experienced, and to share the expertise it was the motivation to make it.
Your experience here shaped your opinion regarding the treatment of neurotrauma?
Okay, so as long as 15 years I'm regularly on duties on the emergency medical helicopter. So there are many which I had. So not every duty means you will deal with traumatic brain injury. It depends on the alert system which patient do need me, but general you can say every day, every second day you are dealing with traumatic patient, with injured patient. Yes, I think so.
And regarding our program, are you familiar with similar programs like this one at the moment? Or are you involved in any of them? You mentioned the Congress.
I have to say the Congress, but that's something different. This is the International Congress of Experts of Air Transport, of Air Medicine. That's where I'm going to participate in June. But like scholarship or programs like that, I was not involved beforehand.
Can you tell me some challenges in the approach of TBI at the moment? Do you have any idea what could we do to prevent neurotrauma?
Oh, that's a different question, because the medicine, how we do it, pre-hospital, in the shock room and in the intensive care station, there is nothing really to improve. I would say so. But to prevent, that's the primary prevention. How to prevent the traumatic brain injury, but that is not job only of the doctors. That's job of the politics as well.
Yeah, that's right.
So carrying a helmet during skiing, for example, with the standard in Austria, I have to say it.
And about the cases that you've encountered, could you tell us a few words about the most maybe complex and difficult case in your career so far?
Look, once a patient come to my intensive care department, he's critically ill. He or she is critically ill. So there is at least one vital function which doesn't work. And that's the complexity. That's the complexity. But you can not only make a therapy for a liver, for example, to ignore the heart or the brain. Every people, it doesn't matter which is the reason why he came to the intensive care, to the intensive care department. It's critically ill. I don't have in my head any complex specific case. Maybe I can tell you. You need you see behind. You see the big wall with an alpine setting. I have a family who dropped down 150 meters. The father died on this accident.
Yeah.
One child died, and the second child we managed to rescue with a good neurological outcome. That's maybe a case which I am thinking a lot about.
I see. inequalities in the medical field are becoming more and more visible. Considering this, do you think is it a good thing? Like an online community would help medical practice today?
Yes, of course. I think everybody who can help to prevent something or to therapy something, it's important. It's important for the patient.
Do you consider that the COVID-19 has impacted the management of neurotrauma, and how? And maybe your work overall?
Yes, of course. That was an impact of this pandemic. Definitely.
I see.
First of all, the people stayed at home, so we saw less injured people in this time.
So it affected basically also in a good way.
No, that's not a good way, because the intensive care department were full from the COVID ill patient. So once something happened, we have to search to look for a free opportunity where we can bring the patient, because every intensive care unit was full of the COVID patients.
We had one more question, but I guess the noise will have to.
I have time. It's going to start both of them. They make the primary mission, there's the secondary. That's a pity for the colleagues, but there is no helicopter here. That was the primary machine, and as you see, in 90 seconds in the air. And you see the machine starts, then turns against the wind direction and goes up, and then mission was to Linz, in Upper Austria, and this mission primary is to the next door, behind the hill. There is a small village, and there is a patient.
Okay, so our last question was,
yes,
from your perspective, which are the obstacles that would affect the proper long-term follow-up of patients?
That's a difficult question for me, because that's not my everyday job to follow up the patient. Unfortunately, I lose my patients in the follow-up when the patient is when I can transfer the patient to a normal ward, to a neurology or neurosurgery or traumatology ward. And then after leaving the hospital for the rehabilitation, sometimes a couple of patients come back to us, to the intensive care unit, and ask, "Do you know me?" Say, "Sorry, no. I don't know you. So many patients here. You had no hair in my bed. You are a different man. Who are you?" And then he tells or she tells the name. "Oh, Really, and that's the only follow-up I sometimes have, but it depends on the patient itself to come and to say thank you or something like that. So I'm in my job as intensive care medicine, I have no follow-up of the patients.
Right. Well, that was it. Thank you for your time.
Thank you very much.
Thank you for your presentation.
Thank you very much.